obviously I can't do both sides, so it's just whatever is going to look best for you at the back.
That'll be fine. I'll just move a wee bit there.
Is that right?
That's quite all right.
Do you want me to do a stand test? Of course I can. Do you want me to count to 10 for you?
Yeah.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That way?
Yeah.
As long as we've got the words behind us, that's all.
Yeah, that's fine.
Alright? We're filming here?
No, I mean, we like half it. That's not true. I mean, it's 2 square sausages in it. Something like that. No, because I have to I can do it straight down here as well. We have to get enough the other day on time, we actually are forgetting. You go there for this. That's not bad. That's not bad.
No.
Hi, I'm just
Just about, isn't it?
Yeah.
I did my undergrad in Dundee.
Oh, cool. Oh, nice. Yeah.
I was a big fan of the podcast and all stuff.
Thank you.
Yeah.
Glad you're listening.
Let's say that would be
Yeah,
Of course. Yeah.
I just wanted to say thanks.
No, of course not. I'm still.
No, I'm here. I'm doing a master's at college.
Okay.
Yeah. I'm following you, yeah.
Actually, they're not one.
And this is a 5 minutes away.
Okay, good morning everybody, and thank you so much for all coming along today. I suspect the reality is that this morning has already been a frustrating morning for thousands of Scots, both in this city and indeed beyond. They're the patients who have tried to call their GP and found themselves listening to a holding message or getting through to hear that there is no appointment left. I am that patient. But then there are countless others who actually don't call because they don't think it's urgent enough to trouble their GP. And there are countless of others who will get better, but indeed some won't. The fact is, everyone in this room knows that early and preventative care saves lives, it saves money, and it allows us to live healthier for longer. Most of us would prefer to be treated in our own community for the ordinary everyday health issues that we experience. But we'll travel to a hospital for specialist care, and increasingly, though, people are self-referring to hospital because they can't be seen locally or they think it's somehow more convenient. Everyone, including the Scottish Government, believes that it is right to shift the balance of care. But they've been in charge for 19 years now, and they've failed to deliver on any of that. And if anything, it's actually now got worse. Spending decisions tell us that story, with primary care's share of total NHS spend falling from around 11% to just 7%. Now, the SNP also promised to train and recruit 800 more GPs by 2027. We know from Audit Scotland that that pledge will simply not be met. And Scotland actually has fewer whole-time equivalent GPs than we did a decade ago. We also now have fewer GP practices, and we have rising patient lists. Now, I've always believed that fixing our NHS starts with listening to the clinicians who are its life force. And that's why I was absolutely delighted when the two experienced GPs on the panel offered to share their insights on what can be done. Dr. Andrew Buist was the chair of BMA's Scottish General Practitioners Committee from 2018 to 2024. During that time, he saw the consequences of the implementation of the 2018 GP contract, the COVID pandemic, and the increased pressures on GPs in the years since. Dr. David Shackles has been the joint chair of the Royal College of GPs Scotland, along with Dr. Chris Williams, since 2019. And I want to sincerely thank both of them for their insights and their hard work in helping us shape what happens next. Both have decades of experience that they have shared to inform our thinking on the key elements for a new GP contract, which we will start negotiating on the first 100 days of a Scottish Labour government. We are already committed to ending the 8 AM rush and ensuring patients can book advance appointments and, where they need to be seen, access an appointment within 48 hours. We will bring back the family doctor, ensuring continuity of care for you and your family. And we have a long-term commitment to raise the proportion of the health budget spent in primary care so services meet the needs of our population. We have published today an extract of the report from Dr. Buist and Dr. Shackles to give you a flavour of the direction of travel. I think we can all agree that what we need to do to rebuild our NHS is to shine a spotlight on general practice and invest in primary care. So it gives me great pleasure to introduce Dr. Buist to share his insights in how we can ensure that positive future for primary care. Thank you.
Thank you very much, Jackie. You said a number of things I'm going to say myself, but thank you. David and I wrote this paper because we'd become increasingly disillusioned with the direction of travel and lack of progress with the NHS in Scotland. The lack of investment in general practice to keep pace with patient needs and our falling share of the NHS spend. And just about everything that we have said in our paper, I have said to the last 3 health secretaries in Scotland, but it seems to have fallen on deaf ears. The ATM rush to get a GP appointment. Engaged phones, long queues, and when you do get through, you're told there's no appointments to see you. That is intolerable, it's unacceptable, and it needs to be fixed. But to fix it, we need to understand why it has happened. And let me put one thing to bed first. It is not due to a lack of effort by general practitioners. Official figures for the 12 months up to September 2025 showed that there were just under 32 million appointments given out in Scotland. That's 2.4 million more appointments than the previous 12 months, or a 7% increase. Can you tell me any other part of the NHS in Scotland that has improved its productivity in the last 5 years? No, the reason for the ATM rush is due to a shortage of GP workforce. In the paper you will see a graph of GP workforce plotted over from 2013 up to 2025. The reason is the Scottish population has increased by almost 500,000 people, while at the same time the GP whole-time equivalent has stayed almost flatline and slightly gone down. You will also note the number of consultants has considerably increased over the same period. But the Scottish population is also getting older, and when we get older we get more long-term conditions like diabetes that require interventions in primary care. And patients are also waiting longer for hospital treatments. And you don't wait just in a queue, you go back to your GP because the pain is still there. So that creates more workload in general practice. Now, the Scottish Government, to their credit, recognised this was a problem in 2017. They had a policy intention to increase GP numbers by 800 in 2027. But we now have less whole-time equivalent GPs than there were in 2017. And as Audit Scotland reported last year, the target has a 0 chance of being met. So why was the target has the target been miserably failed? The answer is simple, because almost no funding has been allocated to make it happen. In 2018, the average number of patients per GP was 1,515. Today, it is now 1,680. That is an increase of 165 patients per GP. 1,680 patients is too many for a GP to provide good quality care, and it is why patients struggle to get an appointment when they need one. To improve patient care, we must reduce the number of patients per GP. To do that, we must give practices the funds directly to increase GP sessions and take on additional GPs. Now, the rate of progress will be determined by the workforce availability and the availability of funding from the Scottish Government. But we need almost 400 GPs to get back to where we were in 2013. And that wasn't a particularly good time either. So the next Scottish Government needs to be bold and ambitious and go beyond where we were 12 years ago. Now, some of you may have seen there's been a proposed funding package offered to GPs from 26-29 from the current Scottish Government. It was announced in October. On the face of it, there are similarities with what we are saying. But this Scottish Government has a track record of failing to deliver on GP agreements. Just look at the 2018 contract and the additional 800 GPs that didn't appear. The funding is also contingent on future spending reviews. And why have they waited until the end of this Parliament to do something about a problem they knew about at the beginning? I will now hand over to my co-author, David Shackles. He's the immediate past chair of the Royal College of GPs in Scotland, and he will outline the benefits to patient care and the wider NHS if we are able to substantially increase the GP workforce and improve patient access. Thank you.
Thank you. Thank you. Good morning, everyone. And thank you, Andrew. Andrew has clearly outlined the workforce challenges. And as an NHS GP for over 30 years, I can fully understand the pressures on the whole system. I'm now transitioning from being a working GP to being retired. I'm a patient as well. I really have got skin in the game here. And what has become clear is that these workforce challenges, the increasing patient list size, the change in working patterns, the greater complexity of care, translate in practice to a reduction in the continuity of care. And multiple research projects have demonstrated the benefits of continuity. It's really been put forward as one of the essential pillars of a highly performing primary healthcare system. And the evidence base is significant and enlarging. So improving relational continuity has been shown to reduce hospital admissions, particularly for our frail elderly, and that's an increasing issue in Scotland today. It reduces attendance at A&E. We always know we're being asked to protect A&E. This is one of the ways that we can do it, by improving our continuity. It improves the uptake of advice about lifestyle and prevention, crucially including screening and vaccination. And we see the situation in London today with increasing measles cases. We want to prevent that. We want to get our public properly informed and properly vaccinated. Improve concordance with treatment and medication, and that reduces waste, another big demand for Scotland to reduce healthcare waste. And it increases patient satisfaction. And to cap it all, it actually has been shown to lower death rates. So if continuity was a drug, patients and politicians would be demanding it was freely and consistently available on the NHS. So whilst, as Andrew said, the whole-time equivalent GPs have really stagnated over the last decade, there has been an increase in the numbers of other health professionals working in the primary care and general practice setting. And whilst this is very welcome and necessary, we still need the time and effort and sustainable and satisfactory premises so that we can build coherent, co-located teams that will negate any of the fragmentation of service and release the value that these other health professionals can really bring to the system. This is where the government's current plan for GP walk-in centres is not going to be the magic bullet for GP access. It's only going to bring a benefit to a minority of our population and patients, but at the expense of further fragmentation of the system. There's going to be an absence of relational continuity here. There's going to be limited informational and managerial continuity. And I believe it will be much better to switch that investment into core local GP services, particularly targeting the areas of highest deprivation and need. Right now, we can encourage and incentivise practices to build continuity, but to reap the true benefits that relational continuity of care can deliver, it's abundantly clear that we need many more fully trained general practitioners working in local community general practices. My next point is around health promotion and prevention. I mean, these areas have been bread and butter subjects for GPs for decades. But in recent times, despite multiple reports and research acknowledging that they're crucial to improving the health of our nation, resource allocation always tends to focus on the acute and urgent care sector. And we really have to recapture the initiative here to commit to focus time and effort in this field. Now, with adequate planning and expanded capacity, general practice remains the logical vehicle for all manner of preventative strategies, including screening and including vaccination activities. We've got to look to digital solutions for information gathering and communication with our patients, and that has an increasing role to play in chronic disease management. And we mustn't fall further behind the curve in developing and using these technologies for recording and delivering these healthcare innovations. GPs are some of the few expert medical generalists in the NHS, and we can and we do greatly contribute to the whole care system. Where we can offer easier, timely access to a known and trusted GP and a GP team, we take pressure off secondary care. And that's 24/7. We are a 24/7 service. We have very functional, good out-of-hours teams. And this is essential. And what we want is our consultant colleagues to be doing what they do best, seeing those patients that really need and benefit from the specialist expertise. It's no secret that general practice has the shortest training programme of all the medical specialties, still only 3 years. And in Scotland, our registrars spend less time in general practice setting than their colleagues in England. So to create and sustain the best service for our patients, we have to adequately train, nurture and support our young doctors to provide a career in Scotland that's professionally rewarding and that's valued. We urgently need the expansion of GP fellowships and career start posts that can help to develop and support early career doctors. We can't afford to be losing either our locally trained or our international medical graduates from the system. Recent increases in medical student numbers mean that the workforce pipeline is starting to flow. May only be a trickle at first, but our politicians have to be bold, invest in general practice training, development, and crucially, develop in substantive jobs that they can go on to whilst this opportunity still exists. So thank you very much, and I'm delighted to hand over to Anas to give his comments. And thank you so much.
Thank you so much. Can I start by thanking Dr. Buse and Dr. Shackles for not just their comments, but the incredible hard work that has gone in to producing the paper that they have, demonstrating a seriousness about what we want to do differently here in Scotland post the election on the 7th of May. And I must say, as a former general dental practitioner, to be such a champion for GPs is also novel and different for many a dentist I know across the country, proving that we want to bring the NHS family firmly together as part of our ambitions for Scotland. Look, what they've set out in both their contributions and also in the report demonstrates how seriously we are taking the big challenges confronting Scotland. And I know too often our politics can often be focused on the ups and downs, the ins and outs of individual political parties. But what the election on the 7th of May has to be about is the different direction we take here in Scotland. That's been set out really powerfully by both Dr. Buist and Dr. Shackles. Because let's look at the reality on the ground. As Jackie set out already, every single day there are thousands, if not tens of thousands of people stuck on phone lines trying to get through to get an appointment. There are countless patients who are receiving regular text messages in the morning to say, don't bother phoning because no appointments are available. And as already been set out, much of the challenges in acute care are then overburdening primary care, where people waiting far too long, for example, on an NHS waiting list, often in chronic pain, they have no choice but to present themselves at a GP practice, or no choice then to present themselves at A&E. So if we are to confront the big challenges facing our NHS, both in terms of waiting lists, but also in terms of access to GP services, ending the ATM rush for a GP, making sure people get an appointment within 48 hours if they need it, and also the exit door of our NHS, then we have to shift the balance of funding and the balance of care to prioritise both primary care and social care. And we'll say more about social care on a different occasion, but let me just focus on primary care. We are absolutely clear that within the first 100 days of a Scottish Labour government, we will open negotiations on a new GP contract. And the red line in any negotiation will be increasing access for patients to primary care. And that's not because that is some kind of threat or some kind of battle, but it's a recognition that we have to better support, better resource primary care, better support, better resource GPs, better support, better resource the staff within a GP setting, and we have to better support and better resource those that require wraparound community care across our country. So it's a really, really serious and important piece of work. And as also been highlighted by both Dr. Buist and Dr. Shackles, is I think people have heard enough of the lip service that's paid by government, heard enough of the gimmicks about what might come or what might be promised. What they need is a government that's going to work as hard as our NHS staff do, and a First Minister and a government that shares the ambition and the expectation that our population do. And that's what I'm absolutely determined to deliver over the course of the next Parliament. And that will be outcomes focused, not just focused on inputs. How do we improve the outcomes for people across the country so they can live the lives that they want to live? Now, I often think about some of the different debates that have been had around the NHS and the kind of care, and I think there was, in previous generations, a big push towards specialisms, and I can understand why there was a big push towards specialism. But I actually think, with an ageing population, with more comorbidities, with bigger challenges, we really do need to prioritise general medicine and the power of general medicine so people can get the support and care they need. And that's what's been set out in the Buist and Shackles paper that's been set out in front of us. So the dividing lines for the election are becoming clearer and clearer. I want to focus on the issues facing our country. I want the election to be about the future of our NHS. I want it to be about the future of primary care, social care. I want it to be about what the expectations are for our people in our towns, our cities, villages and islands, about the kind of health service they want, about the kind of lives they want to live, what it means for their local services and what it means for their outcomes. So for me, the NHS, the future of our NHS will be on the ballot, will be a key dividing line in that election campaign and a key priority for us. So we've set out around renegotiating the GP contract and improving those outcomes, so ending the ATM rush for a GP, bringing back the family doctor, ensuring we have continuity of care, as has been emphasised by both Dr Buist and Dr Shackles, ensuring that people who need an appointment get an appointment within 48 hours, and making sure we shift the balance of investment to make sure we are properly resourcing and funding primary care in order to get the outcomes we want to see for our country. And that's on top of the proposals we've set already around cutting the bureaucracy and the red tape, so we can shift the balance away from the chief executives, the managers, and more to the front line in terms of more doctors, more nurses and more treatment for people across the country. And that's a debate and a discussion that I relish over the course of the next 79 days, I believe, as we head towards the election on the 7th of May. Of course, there's lots more I could say, but we'll open up, I think, now for some questions. I realise there'll be some wider issues I imagine some might want to question us about, but if there are issues that are relevant, of course, to Dr Buist and Dr Shackles, I will give them an opportunity to come in and speak as well. But let's open up to some questions, and I have a list in front of me. I'll take Rebecca from the Herald first.
Hi, the Culture Secretary, Anas Sarwar, is calling on you to return cash, or Scottish Labour to return the cash from Labour together. Will you do that?
Well, first of all, let me say that the most important issue here is about press freedom and to make sure we're respecting the fundamental principles of our democracy. And I will always be a champion of a free press, no matter how difficult sometimes the press can make life for all of us. I will always be a great champion of that. And let me tell you why, as one prime example. If you think about the huge scandal at the Queen Elizabeth University Hospital, if it wasn't for not just the bravery of the doctors, not just the bravery of the families, but also of journalists willing to ask the difficult questions, do the reporting and take on the establishment, we wouldn't be where we are today, one step closer to getting truth and justice for the families. So that will always be my first priority. It's right that there is an investigation, because I'm deeply concerned by the reports that I've heard. On the specific question though, I think it's a bit rich for the SNP to be talking about the finances and the donations of any other political party, to be frank. And when I heard John Swinney talking about dodgy organisations, I thought it was very, very brave territory indeed for him. I'll take David from the Scotsman.
Yeah, two questions, if that's all right. The first,
No problem.
On the GP sort of announcement you're making today, the SNP are also calling for an end to the ATM rush. I know you called it a dividing line, but you are kind of on the same page about the outcome of what is wanted. Can I just get some detail on you want to renegotiate that contract? Because, as has been alluded to, the SNP government renegotiated the framework of that in October. So, are you looking for that to be unpicked? And is the whole point of that to kind of ensure that doctors are working longer, or there's more coverage across a longer period for people to get their appointments? take that.
Should I take that one first? Do that. I'll come back to you. Let me just first of all say that the SNP can state whatever ambition they like. They're going to be judged on their record and their delivery. They've been in office now for almost 20 years, and they can't pretend that somehow they're this newborn government where John Swinney has been at the heart of everything for the last 20 years. And what we can't allow is what they're approaching now to be their own version of a painted-on window on a ferry that never sails. And that's what the risk is right now, where they're doing stunts rather than doing the hard work to fix primary care. And what I'm saying is, we are going to do the hard work. We are going to open up the negotiations within the first 100 days. The purpose of that negotiation, yes, will be to improve access, but it will also be to make sure we're properly resourcing and supporting both individual GPs and GP settings, both in terms of their own responsibilities, their own resourcing, their own rewards, of course, and also the broader support team they need around that GP team. And I'm really absolutely clear that that's what we'll do, with the stated ambitions of ending the ATM rush, of making sure if someone needs an appointment, they get it within 48 hours, delivering that continuity of care so we bring back the family doctor, and shifting the balance of investment so we do support the two parts of the NHS that are currently under-resourced and therefore putting even more pressure on the acute setting. And that is primary care and social care. That's the way we fix our NHS and make it fit for the future, rather than the gimmicks and the stunts from the SNP. To be honest, Dr Buse and Dr Shackles already said in their contributions, I'll let them come back in if they want to come back in on this as well, is they've heard lots of promises before from the SNP, they've heard lots of announcements before from the SNP. It's very easy to make new announcements by them 3 months before an election where they're trying to get a third decade in power. If they had a plan to fix it, they would have done it by now. And the clear choice in the election is more of the same with the SNP, more stunts, more decline, not fixing the problems that confront our great nation, or a new government that works as hard as our NHS staff do, that share the ambition that our people do, and that's going to confront the big challenges facing our country so we can make sure we're fit for the future. I'm not sure if Dr Buse or Dr Shackles want to come in. No, they're happy with that. Second question, sorry, David.
It's just a general political one. There you said there's a straight choice between you and the SNP, but if you look at all the polls, it shows that no poll shows that you can kind of win this thing, given it's, as you said, 79 days away. Is now the time to admit that basically your task and the best you can hope for is to stop the SNP getting a majority, rather than actually being able to challenge them to form the next government?
What I would say, David, is I am being straight and serious. That this is an election we can win, and this is an election that I'm absolutely determined we do win. If I took every poll and every commentator that said we couldn't win, I wouldn't have become the leader of the Scottish Labour Party. I wouldn't have got us back into second place at the last council elections. We wouldn't have won the last general election. We wouldn't have got 37 Scottish Labour MPs. We wouldn't have won the Rutherglen and Hamilton West by-election. We wouldn't have won the Hamilton by-election. So I have defied the odds before, and I'm absolutely determined to defy the odds again. Because I honestly believe when the choice is put in front of the people of Scotland of a third decade of rule under the SNP and John Swinney, or a new direction with me in Scottish Labour, I firmly believe when the choice is put in front of the people of Scotland of a government that will lead with honesty, transparency and focused on delivery versus the dishonesty and the failure of the SNP, I honestly believe when it's put in front of them about our plans to fix the NHS, grow our economy, guarantee opportunities for young people and respect people's money rather than put more and more burden on the taxpayer, versus the 2 decades of decline we've seen under the SNP, I am so confident that that's an election we can win, and I'm absolutely determined to do that. I'll take Craig from PA.
Russell Finlay says eyebrows have been raised over the amount of time it's taken for police to investigate the SNP's finances. He wants an explanation from the Crown as to why Peter Murrow's plea has been put until after the election. Do you agree with him, or do you think this is politicians politicising the court system? Well,
let me just first of all say that I am not going to say anything that prejudices any police investigation or any process that's going through the Crown. Are there questions that need to be asked and answered? Yes, but that is for the Crown to answer and for the public to get as much transparency as possible. But I'm not going to get into a deep debate about the rights and wrongs of individual judicial processes or outcomes. I'll take Justin from P&J.
Thanks. I just wanted to follow up on Rebecca's question. Would you urge Labour politicians in Scotland who have received money from Labour Together to give that back, just firstly?
We announce our donations in line with the rules, and all donations were made in line with the rules and legal, so that's not something we're looking at. But is there a genuine investigation that needs to be had on the claims that we made? Yes. Will I always defend and support press freedoms? Absolutely. Am I deeply, deeply concerned by some of the reports? 100%. But lots of these questions are being posed by SNP politicians that literally have no leg to stand on. I do not think they should be trying to make a big national debate about what happens with donations and public finances. And I also think the barefaced cheek of John Swinney to go on the record yesterday, on camera, to talk about dodgy organisations, I just think it's very, very dodgy territory for them. And if I was them, I would seriously ignore it.
And second,
yeah, on you go.
As well. Talking about, we're talking about primary care today, and it's been very, very serious matters being raised. But when it comes to Labour right now, people are talking about whether it be Labour Together scandal, whether it be Peter Mandelson, whether it be Pam Duncan advances ties to former Money Councillor Sean Watton. Are you worried that these problems will undermine your election bid? Because when you look at the news cycle right now, that's what people are talking about when they talk about Labour. They're not talking about the issues you want to be raised here. So are you concerned that will undermine your bid to become First Minister?
So, again, go back to David's question, because it's relevant to what you're asking, Justin, is what are the things that are making people worry every day when they get up in the morning or when they're sitting around the dinner table? When they wake up in the morning, they're not saying, I wonder what's happening with Labour Together. What they're saying is, I wonder if I'm going to get my GP appointment today. Or when they go into work, they're worried about the transport issues that exist in our country. Or they're worried about the kids, whether the kids are going to get the education they need, whether they're safe in the classroom, whether they're going to get the access to the college place, university place, or apprenticeship they need, what they're going to do with their future in terms of their lives. They're worried about their bills when they're around the dinner table. These are the big issues that people are debating and thinking about. And so I can understand why people want to say that somehow everyone in our country is obsessed with internal Labour dynamics or internal SNP dynamics or the dynamics or the ups and downs of individual political cycles. I am going to focus on the issues that actually matter to people in this great country, because I am not willing to sacrifice, let me be really blunt about this, I am not willing to sacrifice Scotland, our NHS, our schools, our skill system, our criminal justice system, our housing market, our towns, cities, villages and islands to the politics or the dynamics of the ups and downs or what's happening somewhere else. This election for me is going to be about the issues I'm talking about, and I honestly believe that it's an election we'll win because we will focus on those issues and give the answers and the solutions to the big problems facing this country. That's what Dr Buist and Dr Shackles will rightly demand of every politician, not just a Labour politician, every politician. It's what people out there in the country will demand of anybody that aspires to be First Minister. And as the person that aspires to be First Minister, to lead the country that he loves and who will always have Scotland as his first priority and his first loyalty, I'm going to make sure we win this election for the great people of Scotland. Thank you all so much. Thank you. Staying in for some clips, are we, Ollie? Or
we're going to do some media clips, and then I think we can either do them here, we can do them in the corridor.
Great, no problem.